Hello, I'm Dr. John D. Carlson, an Austin, Texas chiropractor, and I'd like to answer the question for you today. What is a herniated disc? If you're watching this video, you or someone close to you that you love has injured their back and is having pain in their neck or lower back and also in their arm or their leg. Oftentimes that can be due to a herniated disc. For you, maybe you were out in the garden, you were lifting something, you were pulling. Maybe you just reached down to lift a paper clip off the floor. Maybe you've lifted your grandchild, or you coughed or sneezed, and then you had the impending pain. All of those can be due to a herniated disc, and they can come on pretty rapidly. But you go to the doctor, maybe you've tried the hot tub, the shower, maybe you've had massage, maybe you tried all the over-the-counter drugs, and the pain's still not getting any better. In fact, it's getting worse. So you go to the doctor, and the doctor says, you have a herniated disc. And your question is, doctor, what is a herniated disc? Most herniated discs occur in the neck, the cervical spine, or in the lower back, the lumbar spine. For the most part, there's some differences in the anatomy, and today, for convenience, I'm going to use a lumbar spine model, a lower back model, to help you understand. But in between the bones of the spine, called vertebra, there's a shock-absorbing cushion called the intervertebral disc. That disc is made up of ring fibers of cartilage that hold in a thick liquid nucleus. That thick liquid nucleus is so thick, if you were to put your finger on it and pull up on it, it would be thick like hot sticky gum. Now, it still has fluid dynamics, which means that when you put pressure on it, it doesn't compress, it spreads out much like a bag of water. About age 25, the ring fibers of cartilage begin to dry out and become brittle. And then when pressure gets put on our body by doing the activities of carrying, lifting, coughing, sneezing, sitting, it doesn't have to be much, because when the tissue finally breaks, it finally will give way. The ring fibers of cartilage will crack and tear. The pressure on your body will cause that liquid nucleus to migrate into the crack or tear. Then the weakened cartilage will begin to bulge, protrude, and herniate. When that hits on a nerve, that can cause quite a bit of pain. If it's in your lower back, it can cause pain down your leg, all the way to your foot, and it can also cause pain in your lower back. You can also have neck pain, upper back pain, and pain radiating into your arm and all the way down into your hands and fingers. There's other type of disc injuries, like a ruptured disc, a sequestered disc, a fragmented disc. But what we're talking about today are called contained herniated disc. There are other forms of non-contained herniated disc, and the contained herniated disc are the ones that respond best to non-surgical spinal decompression. Hey, I hope I've answered the question for you. What is a herniated disc? I hope to see you again soon, and when I do, I hope to find you enjoying life and life to its fullest.